Hey everyone, welcome back to Village the Health. Today, we're diving into a crucial topic that could be affecting millions of people around the world: fatty liver disease. It's often silent and subtle, but if left untreated, it can lead to serious health issues like liver failure, cirrhosis, or even liver cancer. So, if you or someone you know is at risk, don't miss these 8 warning signs of fatty liver disease. Let's get started. Jaundice. Let's start with jaundice, one of the most recognizable signs of liver problems. Jaundice happens when your skin, and sometimes the whites of your eyes, turn yellow. This yellow color comes from a substance called bilirubin. Normally, your liver processes bilirubin and eliminates it from your body through bile, but when your liver isn't functioning properly, bilirubin builds up in the blood, causing that yellow tint in your skin and eyes. Jaundice can be a sign of many liver conditions, including fatty liver disease, so if you notice any yellowing, especially in your eyes, you should see a doctor right away. It's not something to ignore, as it indicates your liver may not be doing its job properly. Dark urine. Next up is dark urine. While dark-colored urine can sometimes be due to dehydration, it can also be a warning sign of liver problems, including fatty liver disease. Here's why. When your liver is not functioning well, it can affect how your body processes and removes waste. One substance involved is bilirubin. When bilirubin builds up in the blood due to a poorly functioning liver, it can be excreted in the urine, giving it a darker appearance. If your urine remains dark even when you're well hydrated, it could be a sign that your liver isn't processing waste as it should. This is a signal to consult a healthcare professional to rule out liver issues. Enlarged liver. Now, let's talk about an enlarged liver. Your liver is located on the right side of your abdomen, just below your ribs, and normally, you wouldn't be able to feel it. However, when the liver becomes enlarged, which is medically known as hepatomegaly, you may experience discomfort or even pain in this area. An enlarged liver can be a direct result of fatty liver disease as excess fat builds up in the liver cells. This can cause swelling, and in more advanced stages, you might feel a sense of fullness or pressure in the upper right side of your abdomen. While you may not always notice this on your own, a doctor can detect an enlarged liver during a physical exam or through imaging tests like ultrasounds or MRIs. If you experience any discomfort in that area, it's a good idea to get it checked out before the problem worsens. Pale or clay-colored stools. Next, we have pale or clay-colored stools. The normal brown color of stool comes from bile, which is produced by the liver and stored in the gallbladder. Bile plays a key role in digesting fats, and it also gives stool its characteristic brown color. When your liver isn't functioning well, it may not produce enough bile, or there could be a blockage in the bile ducts. This results in stools that are unusually light in color, sometimes pale, gray, or clay-like. Pale stools can indicate that your liver is struggling to produce bile or that there's an obstruction preventing bile from flowing into your intestines. If you notice this change in stool color consistently, it's crucial to consult with a healthcare provider, as it could signal an underlying liver issue like fatty liver disease or bile duct problems. Spider veins. Next on the list are spider veins. These are tiny, web-like clusters of blood vessels that appear close to the surface of your skin, often on your face, neck, chest, or legs. They get their name because they look like small, red or purple spider webs. Spider veins can be a sign of liver disease because when the liver isn't functioning properly, it can cause changes in your body's hormone levels. Specifically, a damaged liver may lead to higher levels of estrogen in your body, which causes blood vessels to dilate and become more visible under the skin. While spider veins can occur for other reasons, such as sun exposure or genetics, their appearance alongside other symptoms of liver disease could be a signal that your liver is in trouble. If you're noticing an increase in these tiny veins, especially with other symptoms, it's worth getting checked out. Swollen abdomen. Up next is a swollen abdomen, medically known as ascites. This happens when fluid builds up in the abdominal cavity, leading to noticeable swelling or bloating. Ascites is often a sign of advanced liver disease, including fatty liver disease, and occurs when the liver's ability to manage fluids in the body is severely compromised. When the liver becomes damaged, it can't produce enough proteins like albumin, which helps regulate fluid levels in the bloodstream. As a result, fluid leaks out of the blood vessels and accumulates in the abdomen. This can cause discomfort, difficulty breathing, and a tight, swollen feeling in your belly. If you notice persistent bloating, especially if it doesn't go away and worsens over time, it's important to seek medical attention. A swollen abdomen can be a serious indicator that your liver health has deteriorated. Skin issues. Next, let's talk about skin issues as a potential sign of liver problems. When the liver isn't working properly, it can lead to a variety of skin changes. For example, you may experience chronic itching, dry patches, or even unexplained rashes. The reason for this is that when your liver struggles to filter toxins from the blood, those toxins can build up in your body, affecting your skin. Additionally, liver disease can cause bile salts to accumulate under the skin, leading to intense itchiness that doesn't seem to go away, even with moisturizers or over-the-counter treatments. You might also notice other changes like yellow bumps from fat deposits or red palms. If you're dealing with persistent skin issues that don't respond to normal treatments, it could be your liver sending a warning signal that something is wrong. Be sure to consult with a healthcare professional if these symptoms appear. 607. Fatigue. Last but certainly not least is fatigue. Fatigue from liver disease isn't the kind of tiredness you can shake off with a good night's sleep. It's a deep, persistent feeling of exhaustion that can affect your entire body. People with fatty liver disease often report feeling drained and weak, even after rest or minimal activity. This happens because your liver plays a key role in regulating energy levels. When it's damaged or overworked, it can't process nutrients and toxins efficiently, leading to a buildup of waste products in your bloodstream. This, in turn, can sap your energy, making you feel constantly fatigued. If you're experiencing ongoing fatigue that doesn't improve, especially alongside other liver disease symptoms, it could be a sign that your liver isn't functioning properly. It's important to get this checked out before the condition worsens. So there you have it, the 8 warning signs of fatty liver disease that you shouldn't ignore. If you recognize any of these symptoms, it's important to get checked out by a healthcare professional as soon as possible. Early diagnosis and treatment can make all the difference, so don't wait until it's too late. And if you found this video helpful, please give it a thumbs up and subscribe to the channel for more health tips. Thanks for watching, and take care of your liver.